Hello, so this is about tips to combat student depression. Unfortunately, depression is not uncommon. The American Psychiatric Association reports 1 in 6 people will experience depression at some point in their life. More than 300 million people around the world live in depression, according to the World Health Organization. The National Alliance of Mental Illness reports 75% of all mental health conditions begin by age 24. Depression is defined by the APA as having long-lasting, moderate to severe feelings of sadness and or loss of interest in one's enjoyable activities. It can cause numerous problems, including sleep troubles, loss of appetite or weight gain, difficulty completing everyday tasks. For college students with depression, the illnesses can affect the ability to focus, study, and successfully complete assignments and tests required to graduate. So as I said, this is about student depression, so it does focus on college students. Depression can strike at any point in someone's life. This guide explains common cause of signs of depression, how we seek treatment for depression, and resources for college students who are experiencing this mental disorder. Common causes of depression. Depression can be caused by both genetic and external factors. Common causes of depression cited by the APA include biochemistry, which means chemicals in the brain can affect a person's likelihood to experience depression. Genetics, because depression can be inherited, identical twin studies have shown a 70% likelihood of an identical twin having depression when the other twin is depressed. Personality, since people with personality characteristics such as low self-esteem, a pessimistic outlook on life, and a low capability of handling stress are more likely to experience depression. Outward factors such as exposure to violence, abuse, or a significant loss. College is stressful for all types of students. Major life events, even positive ones such as beginning college, can be difficult to adapt to. Anyone can encounter symptoms of depression every now and then. However, an indicator of depression is when symptoms are prolonged and interfere with everyday functioning for a couple of weeks or more. Doctors and mental health professionals can diagnose depression. So what are some of the warning signs of depression that a college student should be aware of? Feelings of sadness, loss of appetite or overeating, diminished interest in participating in activities that were once enjoyable, trouble sleeping or sleeping too much, feelings of guilt or worthlessness, decreased energy, thoughts of suicide or increased thoughts about death, difficulty concentrating and making decisions, stark change in physical activity and movement, such as prolonged pacing or shaking of one's leg, persistent headaches, stomach aches, or muscle aches. If you start to feel these symptoms, keep a journal and record their progression. This will help you talk about what you're experiencing with a doctor or a therapist. Know whether any life changes have accompanied the symptoms. So you can address potential causes. What to do if you think you're depressed? It is best to treat depression as early as possible. If you've experienced symptoms or depression for a couple weeks or more, talk with a professional therapist, primary care doctor, or a psychiatrist. This person will be able to help you diagnose you with depression and help you uncover any other medical issues that may be causing the symptoms. Depression can be treated with medication, talk therapy, or a combination of the two. Various types of therapy can be tailored to help your unique situation. A doctor or therapist may recommend you meet a psychiatrist who will be able to prescribe medication if the depression is caused by exacerbated or biochemistry or genetics. In addition to seeking professional help, self-care is important to lessen the effects of depression. So self-care for college students includes getting enough sleep, which is 7 to 9 hours a night, taking care of your body, eat nutritious foods, get at least 2.5 hours of moderate intense exercise each week, do muscle conditioning activities at least twice a week, avoid alcohol or illegal drugs. Alcohol is a depressant that can worsen the symptoms. Managing stress, spend time with supportive friends and family members, and participate in enjoyable hobbies. Get more I might do stress management tips for college students at some point because I have to say that did help me. So, while these self-care tips are important to do for the rest of your life, if you think you're experiencing depression, it's best to talk with an expert for his assistance. If you're experiencing thoughts of suicide, call the National Suicide Prevention Line at, so I'm going to include the number for the National Suicide Prevention Line, which is, I'll actually say it here too for people who might not have the best reading ability, because I know that is a thing. The line is 1-800-273-8255. If you need to pause that, go back, whatever, but please, if you're experiencing thoughts of suicide, please call them. The line is open 24/7, and you can talk with someone for free and get resources to help you. All calls are confidential. So mental health resources for college students. If you're experiencing depression, you're not alone. It can happen at any time and maybe reoccurring experience. Many resources are available for college students to get help. So there was that one, which is the National Suicide Prevention Line. I mentioned their number. There's ulifeline.org. This website has resources dedicated to mental health for college students, including how to help a friend. The Anxiety and Depression Association of America, find a support group for depression. It including one of that are online or over the phone. And is also the mentalhealth.gov website. So that's it. Thanks for watching.